Hello and welcome back as we continue on our discovery of wound healing with the first step of wound healing known as hemostasis. And yes, we've talked about hemostasis before when we talked about blood function, so there is great overlap. So the whole point of hemostasis and wound healing is to stop the damage from continuing in the damaged blood vessels at the site of the wound. And it's going to have the end result of a clot forming, which is actually going to temporarily close the wound and kind of fill it up. So as you recall, there's three main steps in hemostasis. The first step is vasoconstriction, which occurs, and that is mediated by chemicals released from the damaged tissue, and this is going to happen within seconds and decrease the localized blood flow. The second thing that happens is that platelets are going to be activated and they're going to stick together and will form a beautiful platelet plug. And this will also trigger our third step, which is coagulation cascade, and we can start forming fibrin within about 60 seconds. And as you know, this is a process that is amplified, so it is going to take a good 3 minutes before we have any significant amount of fibrin there, but we can get a really decent blood clot formed in about 6 minutes. The other thing that platelets are going to do is they're going to release some growth factors for vascular endothelial tissue and for tissue growth factors, and those are going to become important in later stages, not in this first stage. And so what this clot does is it's keeping cells, it's keeping platelets, it's keeping white blood cells in the blood close to the site of injury, so then they could do diapedesis at the injury site. And this really is an important part of wound healing, so don't be so quick to pull out a little blood clot from a wound. Now, yes, if the wound is big enough that you need to go to the emergency room and have it sutured, they're going to be taking the blood clot out because they're going to do a primary closure where they're going to reapproximate the normal tissues with each other. But for an abrasion, wounds that happen at home that don't need suturing, the blood clot is very important for wound healing. But let's review the cellular processes happening in hemostasis just a little bit to make sure that you're understanding them. So before the injury, red blood cells, white blood cells, and platelets are circulating around in the blood, as well as antithrombotic agents, nitric oxide and prostacyclins, being released on the endothelial wall, which are preventing platelets from attaching to the endothelium. So at the time of injury, what happens is below the endothelium, we have tissue being exposed, the collagen just below the endothelium. So we call that subendothelial collagen. Okay. And so that's going to be exposed at the same time as the tissue cells that were injured release their vasoconstrictors, causing the decrease in blood flow in the area, slowing it down at the site of injury, allowing time for cells to tumble against the damaged endothelium and subendothelial collagen. Okay, so when the platelets are cruising around at much slower speeds than normal and they come across the damaged subendothelial collagen, they are going to bind to this and to each other. Now, for many years, we just thought this was covalent binding from, it would bind to it, change shape, and then it would bind to the next one, and so on and so on. And we'd have this massive positive feedback thing going on. Now we know that this is very much a ligand binding to its receptor. And so this is what's happening between platelets and to the collagen. And so all this binding is mediated by various G protein coupled receptors, the details of which we're not going to learn for this class. But once again, G proteins, super important and another process in human physiology. Now, when these platelets become activated and start binding, they're going to be releasing a factor of coagulation cascade known as a von Willebrand factor. And this also attaches to the exposed subendothelial matrix. And platelets can bind to this directly, once again, surface receptor, ligand receptor binding. And this is going to strengthen the platelet plug. Now, at the same time that this platelet plug is strengthening and getting larger and larger, clotting factors have, well, chemicals have been released that are going to be activating clotting factors. And so we are going to have coagulation cascade starting at the same time. And it can be activated from the intrinsic method on the damage on the endothelium on the inside, as well as extrinsically at the same time, because there was tissue damage and tissue factor gets activated. And so both pathways are going to come together. We're going to hit factor 10, which is the start of the common pathway. And in about 60 seconds, we will start having fibrin being produced. After a few minutes, like I said, we start having significant fibrin being produced, and then the fibrin is going to start cross-linking with each other and creating this mesh, which is going to happen within and on the top part of the platelet plug. And this mesh then is going to start trapping red blood cells and white blood cells in it. And so now we're going to have a clot or a thrombus forming within that blood vessel, which can completely occlude the blood flow locally. And this is where we are going to have healing. It may completely occlude it if it's a small blood vessel. It may not completely occlude it if it's not a tiny capillary. Okay. And with that, we are done with the process of hemostasis, and I'll see you shortly when we come back and we learn about the second stage of wound healing, which will be inflammation. See you shortly.